recording.
I'll hold it.
Do you want to redo that? Because I was on my phone.
For those who do not already know, I love to play basketball, but I have a tiny little problem with my knees. I've torn my right ACL twice, once at the end of my sophomore year, and once right in the middle of my junior basketball season. It is obvious why I chose this subject, because ACLs are one of the most common injuries in sports today. The knee joint is made up of 3 bones: the femur, which is the thigh bone, the tibia, which is your shin bone, and the patella, or your kneecap. It is held together by 4 ligaments, 2 collateral ligaments that run along the side of your knee and prevent from a sideways movement or an unusual movement. There are also 2 cruciate ligaments that are found inside the knee joint. They cross to make an X, and they control the back and forth motion of your knee. Now the ACL, or the anterior cruciate ligament, runs diagonally across the middle of the knee and prevents the tibia, which is your shin bone, from sliding out in front of the femur, which is your thigh bone. Yeah. And it gives rotational stability to the knee. Now, orthoinfo.org says that ACL injuries can happen when a person decelerates quickly, lands on the knee while it is in a vulnerable position, or through direct contact or collision. However, most injuries happen with no contact at all. An article on the National Institutes of Health states that 97% of ACL injuries happen with little to no contact with another person. Now, there are studies that show that females are 8 times more likely to tear their ACLs than men are. There are several factors that may play a role in this. They are conditioning, muscular strength, neuromuscular control, pelvis and lower extremity or your leg alignment, increased looseness in your ligaments, and the effects of estrogen. Dr. Bowden from the National Institutes of Health says women have a more knock-knee alignment, and women's knees tend to bend more inward when they land. He also stated the theory that women are more ligament dominant as opposed to muscle dominant. Many athletes also have bad jumping form that attributes to their ACL tears. Instead of their calves absorbing the impact when they land, their knees and ligaments absorb the harsh impact when their feet hit the ground. Now, the symptoms of an ACL tear are, at the time of the injury, there will be a popping noise and the knee could possibly give out. There can also be pain and swelling, and the swelling usually happens within 24 hours. Along with that, there can be a loss of the full range of motion, tenderness along the joint line, and discomfort while walking. And after a while, when the swelling goes down, there can be an attempt to return to rigorous physical activity, and the knee might give out again, causing more damage to the cushy cartilage pads in the knee, called the meniscus. Now, after the diagnosis from an orthopedic surgeon, he or she may recommend an ACL reconstruction surgery. Since the ACL cannot heal on its own, a surgeon must go in surgically and repair the damaged ACL. They may take an autograft, which is a tissue taken from your body, or an allograft, which is tissue donated from another person. Then the torn ligament is removed and replaced with a new ligament. Immediately after ACL reconstruction surgery, the patient will be allowed to move their leg. They're usually issued a CPM machine, or a constant passive motion machine, that helps regain full range of motion in your leg. Also, a knee brace is usually required for the first 1 to 4 weeks, as well as crutches. And in addition, physical therapy is usually required to help regain strength and motion in their knee, and can last anywhere between 4 to 6 months. ACL injuries are the most common injury among athletes, and they are definitely not the easiest to come back from. Some athletes never recover. It takes time and dedication and a mental toughness to push through and return to full strength. Thank you for your time.